Empathy has been identified in the nursing literature as a crucial component of the helping relationship, perhaps even the essence of this relationship. The ability to empathize is especially important within today's healthcare system, which is characterized by high technology which can easily dehumanize care. Being able to empathize with clients enables the nurse to understand what hospitalization or pain and suffering mean to them. In its simplest conceptualization, empathy is seeing the world from the client's vantage point, being able to accurately understand his thoughts and feelings. The nurse does not have the same feelings as the client, but rather he maintains his own identity. Studies have supported the fact that being truly empathetic can result in favorable outcomes for clients, such as reduction in anxiety and depression. Empathy is closely connected to listening, in that, first of all, the nurse needs to actively listen to what the client is saying, both verbally and non-verbally. Then, by putting herself in the client's shoes, so to speak, she attempts to understand the client's thoughts and feelings. In other words, to develop empathetic understanding. But the process doesn't stop there. The nurse then conveys this understanding to the client, who can then validate, or if necessary, correct the nurse's understanding. If the nurse has been able to accurately identify the client's thoughts and feelings, he will feel understood, which will then facilitate further disclosure by the client. Nonverbal behaviors, such as nodding one's head or gesturing, can also convey empathy. Perhaps the definition of empathy as given by LaMonica best summarizes this process. Empathy signifies a central focus and feeling with and in the client's world. It involves accurate perception of the client's world by the helper, communication of this understanding to the client, and the client's perception of the helper's understanding. Now that we have looked at what empathy is, it is important to look at what it is not. Empathy is not sympathy. Being empathetic means that the nurse seeks to understand the inner world of the client. Being sympathetic, on the other hand, has more to do with feeling sorry for the client, imagining how you, the nurse, would feel if you were in her situation. This can be particularly tempting to do if the client's situation is similar to what the nurse may have experienced. Empathy is also not responding with a cliché or giving advice. Clichés do not convey understanding and tend to cut the conversation short. Giving advice sets the nurse up as being the expert on the client's life, as opposed to understanding his life, so as to facilitate him managing his problems. Similarly, interpretation is not empathy, as it usually arises out of the nurse's perception rather than the client's perception. Finally, empathizing is not merely restating what the client has said, parroting in other words. Parroting does not convey understanding to the client, and indeed can be an irritant to him, as the nurse can appear robotic as opposed to personable. So how does the nurse ensure that her responses are empathetic and not one of the responses we've just discussed? Even foundational to developing the skill of empathetic response is that the nurse is self-aware, that she is clear about the boundary between herself and the client. Self-reflection, then, is integral to developing empathetic understanding. As well, the nurse needs to be perceptive so that her understanding of the client's situation is accurate, and so that she can identify key points he is making. Empathetic highlights, as Egan describes. Sharing empathetic highlights can improve with practice, but because this is a skill which must be learned, it can be helpful to have a tool at the beginning. Egan and others identify a formula as an effective means to convey basic understanding. Such a formula contains two basic elements. You feel, here giving the correct emotion which the client is expressing,